Good afternoon and congratulations to our graduating class of 2020. My name is Jim Keller and I'm privileged to serve as Chief Medical Officer here at Advocate Lutheran General Hospital. In addition to congratulating all of you on this tremendous accomplishment, I want to offer my thanks to your family and friends for the support that you've given your loved ones as they've gone on to complete this most important part of their career, the most important part of this journey to be able to provide care to the communities and make a real difference. Over the past few years, you guys have participated in the care provided in the hospital. It's easy for us to say that we couldn't have done this without you. I didn't want to emphasize what the last few months have meant to you, but just know that our community would not have been cared for in such a great manner and such a safe manner had it not been for your participation and sacrifices. So please accept on behalf of our medical staff and our administration our congratulations and our sincere debt of gratitude. I know that you guys are going to go on to do some great things and represent us well. Thank you.
Good day, everyone. It's my pleasure to be with you here as you finish up your training at Lutheran General Hospital. I want to welcome all of your families. And if you'd bear with me for just a moment, I'd like to talk about ripples. You remember ripples. Maybe some of you lived near a pond or a lake where you take a small rock or a stone and throw it, and as it hits the surface of the water, ripples go out and out and out until they hit the edge of the lake or the pond. Well, what you've been doing here is pretty much the same thing, except we call it wisdom. So you've been training for a year or 2 years, 3, maybe longer. And every time a patient comes into your consciousness, it creates ripples. And those ripples are about knowledge. You take that knowledge and you apply it. But you see, that's not the same as wisdom. And yes, it's nice to have knowledge. It's nice to know what to do and maybe when to do it. But wisdom is different. Wisdom is taking that knowledge and applying it to the big picture, applying it to other people's lives, to your life and your interconnectedness with other people. So every time you interact with someone, be that a patient, a colleague, a friend, a family, there are ripples. And those ripples of wisdom stay with you forever. So my wish for you is this, that as you go forward from Lutheran General, you understand that ripples will continue to be formed in your life, in your mind, in your heart, in your spirit. And take those ripples for what they are. They're the impact of life on your life. Let it create wisdom in your heart and your mind and your spirit, and put that wisdom to good use as you go forth to heal in this world. Amen.
Hello, I'm Thomas Hansen, Chief Academic Officer for Advocate Aurora Healthcare. I first want to congratulate you for completing your residency or fellowship program at Advocate Lutheran General Hospital. When many of us first entered our professional school, we took the Hippocratic Oath. In that oath, we swore that in purity and according to divine law, I will carry out my life and my art. I've never seen this lived out so clearly as these past few months. While others were social distancing and working from home, you were willing to go immediately to the hospitals to care for the sick in the midst of a pandemic. Some of you were exposed to COVID-19 and had to be self-quarantined. And as soon as the quarantine was over, you were willing to come back to work. Your dedication to our patients, your willingness to help out in the call center, and your ability to help us transform to telemedicine so quickly has been recognized throughout the organization. Thank you for your dedication to our patients and for showing the world what this oath means to us. We also swore in the Hippocratic Oath to pass our knowledge onto students being trained in our profession. While today you are the student, very soon you will be the teacher. I encourage you to surround yourself with residents and students whenever you can. First, they will make sure that you are staying up to date. And I found there are very few things more rewarding in life than having a wonderful clinical practice and to be able to teach. You're going to be able to do both if you choose. Finally, some fatherly advice. If you're like me, the first year out of training may seem a lot like your internship. I remember finishing clinic some days and thinking, how did I go through 3 years of residency and still not see the pathology that I'm seeing every day coming through the door? Be gentle with yourself. Reach out to your peers or your teachers when needed. Remember, we are here for you even after you graduate. I wish all of you the best as you start your next chapter in your career. Congratulations on completing this chapter with us here at Advocate Lutheran General Hospital.
Congratulations, Advocate Lutheran General Family Medicine Residency, Class of 2020. 3 years ago, we stood together on this lawn, welcoming you to our residency, and you started snapping selfies and class photos. And you were looking across this fence to what would lie ahead. Well, now you know. The 3 years are over, and you're ready to launch into your careers as family physicians or entering fellowships in geriatrics and sports medicine. It's been a great 3 years. You faced amazing challenges. You've learned a lot of medicine, and you've recruited and recruited and recruited for us. And thank you. You've done a wonderful job. We couldn't be more proud of the competent, safe family physicians you've become. And I can't resist repeating an overused African proverb that you know well. If you want to go fast, go alone. If you want to go far, go together. You've gone both fast and far. Congratulations and blessings.
All right, sports medicine team. I could spend the next 60 seconds talking about the completely unprecedented, highly challenging times that we're living in, except I'm not going to insult your intelligence that way. The disruption of your training has forced you to learn a lesson a lot sooner than you otherwise might have. And that lesson is this: only you can be responsible for your education. And I can tell you that both Callie and I could not be more proud of the way you've taken charge of yourselves in this regard. Today, you go from being trainees to being colleagues. And Callie and I couldn't be happier to welcome you into that fold. So congratulations, and the best of luck to both of you.
Greetings to all the graduates and their families. I'm Jill Patton, the Program Director of the Internal Medicine Residency. I have been gifted with the management of our most precious resource in medicine and at Lutheran General, the Internal Medicine Residents. Truly, you are our most precious resource. I am so impressed, but not surprised, with your determination in navigating the uncharted. This novel COVID virus transformed the clinical environment, and you continue to learn. You have a ravenous appetite for any publication or resource about the pandemic. You pushed our faculty to consider alternate therapies that improve patient outcomes. You spent whatever time away from the hospital, e-learning, board prepping, managing the ambulatory phone lines for patients who were concerned or had worries about the COVID pandemic. In addition to that, you participated in COVID research and quality improvement projects. There has never been quite a time like this in history, and you have risen to the challenge. I am confident your graduation class will negotiate and pioneer solutions that will conquer the new COVID world we live in, because I have seen you do it. Your class, unlike any other, we will be grateful for, and do not forget, you are our most precious resource. I am overwhelmed with emotion and joy to congratulate each and every one of you on completing this very difficult training in this time. And hopefully we'll be seeing each other outside of Zoom in the near future. And like I say every night when we end our Zoom calls, stay safe and congratulations. Thank you.
Class of 2020, congratulations on behalf of Karen, the faculty, myself, everybody. Clearly one of the most outstanding classes of fellows we've ever had, and I sincerely mean that, both from the academic standpoint and the human standpoint. We will miss you. We wish you the best of luck in your fellowships. All three of you have outstanding fellowships and very prestigious programs. Best wishes to your families who supported you during that time. And we will get together in the fall, and I'll have a lot more to tell you then. Again, best wishes, congratulations, and on and forward.
I'm so proud of our graduating Gastroenterology Fellows for 2020, Drs. Brad Solomon and Henna Omar. Brad and Henna, I've gotten to know you so well over these past 7 years, since you were both inexperienced interns until now, skilled and confident consultants in gastroenterology. You've both made your mark on Lutheran General Hospital. Brad, with your quiet excellence, you always led by example. Henna, excellent. Quiet, not so much, and always a joy to be around. Henna, I'm so pleased that you are going to remain on as a faculty member here at Lutheran General, and I'm counting on you to help us train the future generations of GI fellows. Brad, unfortunately, due to the current circumstances, your future plans have changed and are still a little bit up in the air. But I know that no matter where you end up, you are always going to represent Lutheran General well, and we're very proud of you. I wish you both the best of luck.
This year's Hematology-oncology Fellowship graduate is Dr. Alyssa Seelish. Alyssa is finishing off cycle and will graduate in December. Hopefully, by the time she is due to finish her training, we can celebrate her graduation in a proper way if all of the coronavirus closures are behind us. Alyssa has been with us through residency and through fellowship, and I'm sure she's going to be successful. In addition to being a wonderful hematology-oncology fellow, Alyssa's greatest achievement during her fellowship may have been the birth of her son Jack, who is just cute as can be, and equals her achievement in her training. Congratulations, Alyssa.
Hi. On behalf of the Department of OBGYN, we'd like to congratulate all graduates. It's really sad that you all need to celebrate this significant milestone in your lives this way. But again, this is uncharted territory. To my graduates, I'd like to thank you for all of your hard work and the talent that you've brought to the program. The three of you are a particularly special class to me, as you're the first class that I recruited and supervised throughout your entire residency. It's truly been a pleasure getting to know each of you, and I wish you nothing but the best as you move on to this next phase in your careers. So, congratulations. Now, please go out there and show your colleagues and your patients that we train a hell of a good OBGYN and make us all proud. Congratulations.
Hi, I'm Dr. Slavomir Marichek, and I'm the Program Director of the Minimally Invasive and Robotic Colorectal Surgery Fellowship at Advocate Lutheran General Hospital. It is my pleasure to introduce Dr. Jasvinder Singh, who has been this year's fellow in our program. Dr. Singh has done a great job working as a member of our colorectal surgery team, and despite the recent COVID pandemic, he was able to take a great advantage of the learning opportunities at Lutheran. He has been actively involved and is in the process of completion of several research projects, and his work has been submitted and accepted to 2 major international surgical meetings. He has been a great team member, coordinating the work of surgical and colorectal surgery residents during their rotation with us. Dr. Singh is in the process of finalizing his teaching job position with Metropolitan Hospital Center in New York. On behalf of other members of our colorectal surgical division, Dr. John Park and Dr. Kunal Kochar, we would like to congratulate Dr. Singh on his successful learning experience and wish him all the best in his future practice. Good luck.
Congratulations to all the residents, especially the pediatric residents. I'm so excited to see what the future brings for you, and so thrilled that you will be the representatives of Advocate Children's Hospital Park Ridge and Advocate Lutheran General Hospital out in the world. You are going to have such great years coming up in fellowship and in your jobs, and please remember where you come from, that we are here for you, that we support you. I speak on behalf of all the faculty, on behalf of Katie and Svetlana and the rest of the program leadership team, that you are part of our family, and we cannot wait to see what the future brings. Congratulations.
Hi, Jessica and Shweta. Congratulations on completion of your Neonatal Perinatal Medicine Fellowship. All through the 3 years, both of you have demonstrated sound medical knowledge, great clinical skills, good teamwork, and above all, an exemplary dedication to compassionate patient care. I think I speak for all the faculty here when I say that it was truly a great pleasure working with you and watching you grow into confident, compassionate, and skilled clinicians. I'm very confident that you will do exceedingly well professionally, and I would like to take this opportunity to wish you all the very best in life. Bye.
Hey guys, I'm Vinod Havalat. I'm the Pediatric ICU Program Director. And to all the residents and fellows graduating this year, I just wanted to say thank you for everything you've done for the hospital and for your patients. We didn't anticipate graduation and the end of your fellowship and residency being like this, but I'd like to commend all of you for your grace and resiliency and patience during this time. And I know that you will all be better doctors for it. So congratulations and best of luck to all of you. Take care and best wishes.
Greetings, Michael, Michelle, Justin, Courtney, and Miriam. Congratulations on completing your psychiatry training at Advocate Lutheran General Hospital. As you head out into the world, the faculty and I warmly welcome you to your new role. You are no longer our pupils because you have become our colleagues. We offer you the following wishes and wisdom. Dr. Levin is rooting for you to go out and make a difference in the world. Dr. Murphy encourages you to always dream ahead as your great work is just beginning. Dr. Atienza hopes you will trust your knowledge and experience. He wants you to recognize that you are prepared and so should have confidence in yourselves. Dr. Filippo says keep asking questions and keep making positive changes in your patients' lives. We will always be there for you, so please keep in touch as our friends and as our colleagues. Dr. Segalite encourages you to trust in yourself, be creative, and embrace challenge. Dr. Zander hopes that you will apply all that you have learned and wishes you to know that it has been an honor to have worked with each and every one of you. For myself, I hope that you will always find the opportunity to teach. Teach yourselves by reading, reflecting, discussing, and debating. teach your colleagues, and thereby multiply your impact on the world. And of course, teach your patients and their families. Education is a gift to be shared. And if at times what comes out are the words and wisdom you acquired from us, know that we couldn't be prouder to have supported you on your journey. Best of luck.
Hello, I'm John Ruge, President of the Medical Staff of Lutheran. And on behalf of the medical staff, I'd like to congratulate the class of 2020 at this time of graduation. We are really proud of you. This has been quite a year, hasn't it? I think that you'll never forget, and we will never forget this year. This is a time of crisis and incredible stress and demand and unknown. And you as a class have made us all proud. You've learned from this, you've gained knowledge, you've helped us, all the patients, and really helped show the world what it means to be a doctor. You've shown the community what it means to be a doctor. You've shown your family, and even you've shown yourselves what it's mean to be a doctor at this time, and that knowledge is something very important. It'll be interesting to see what you do and what we all do with this experience, and I'm sure there's a lot of good things that'll come out of it. Telemedicine and how that is now incorporated into our practice to help our doctors and patients will be something to watch, along with many other things that we've learned about community health and stress and how to manage demands. You've been exceptional. Speaking of exceptional, I have also been given the honor of presenting the Alexander Ruggie Humanitarian Award. This is an award given out for one of you who best exemplifies human ecology and has shown your peers and your attending staff this feature, this quality. I happen to know Alexander Ruggie very personally because his name is Ruggie and my name is Ruge. And we used to have physical mailboxes next to each other, and so we often crossed our mail, and I've got to know him as an exceptional individual who, when he asked you how he felt and so forth, he really sat there and wanted to know, and he had a good sense of humor and showed compassion and care, and he just enjoyed being a doctor. He gave of himself because he was the true essence of what being a doctor is, someone we can all emulate. And this year we have 4 exceptional finalists for the Alexander Ruggie Award. Now this is the most prestigious award that this institution gives to residents, and they've carefully screened all the residents that are submitted. It's gotten down to 4 finalists, and then we interview those finalists and come up with a winner. Although this year each of these 4 finalists are so good, we even contemplated splitting the award up into 4, but we thought that might be a cop-out, so we did make a decision. The 4 finalists, and this itself is an award and quite an honor, are exceptional. Dr. Kaja Siraj is an individual family, come from a family of immigrants, who shows a deep sensitivity to his patients and his fellow staff, always working hard, volunteering, and showing a deep understanding for those who have disabilities and who are the underserved. Dr. Margot Deschambre, with her Spanish background, has taken that and dove into the Spanish community with passion, and spent time in the Dominican Republic, and is looking forward to continue on the service with this group and this population in need. Dr. Lauren Schopman, pediatric resident, a tremendous experience with global medicine, having already worked in China, Tanzania, Peru, Dominican Republic, and going on to a fellowship in critical care to hone her skills to go on to do further work in global medicine. A deeply respected peer, one with a calm demeanor, who always was extraordinarily reliable and everyone enjoy working with. Dr. Miriam Abakar at the Department of Psychiatry, an amazing individual, already with a national reputation, won the Illinois Psychiatric Society's Resident of the Year, and has made her expertise and directed expertise to human trafficking. And we look forward to her becoming further a national figure in her field. So 4 exceptional residents. We couldn't be prouder of them. Each of them deserves to win this award, but the group made a decision and we'll donate the $1,000, we'll give the $1,000 honorarium and the award to Dr. Kaja Siraj. So Dr. Siraj, congratulations on behalf of Lutheran General. Class of 2020, congratulations. We're exceptionally proud of you and look forward to hearing more about each of your careers as you move forward. Good luck.
Hello graduates, my name is Dana Johnson. I'm one of the graduating cardiology fellows and a former Lutheran General Medicine resident. I hope this message finds you and your families well in these uncertain times. I hope we're able to take a moment to celebrate our accomplishments which have taken us this far. As I've come to the home stretch of my time here at Lutheran General Hospital, I've been increasingly struck by the way we as physicians and trainees are able to make the extraordinary ordinary. When we first signed up to be residents and fellows, I'm sure more than a few of us balked at the idea of an 80-hour work limit or a 24 plus 4-hour shift. Some doubted it would be possible to even survive. We were excited at the opportunity to make people feel better, but most, if not all of us, felt nervous about dealing with our first patient's death, our first newborn delivery, or our first time counseling a patient about a severe or even fatal clinical diagnosis. As we have progressed through our training, these milestones have become the paving stones we walk every day. A certain sense of normalcy can come to these extraordinary experiences over time. Someone has to do it, and we are the doctors who will. By bringing some normalcy and routine to the extraordinary circumstances, we are able to continue on, to endure, to help another patient. It is our job, and we will do it well. While these sagas of life and death can become a daily grind for us, often muddied by the lack of sleep and heavy workloads, I would encourage you to remember, for the people on the receiving end, this is anything but an everyday thing. Rather, it is a before and after. A family member has never been lost to them before, and they will never lose them again. New parents' worlds will never be the same once you place the newborn baby in their arms for the first time. As you break the news of a cancer diagnosis to your patient, his prior life comes to a screeching halt, and he will need to piece it back together again. We do these things every day, but remember, for our patients and their families, our routines represent a before and after. Their lives will never be the same. From time to time, take a moment to reflect on the befores and afters you are taking a part in every day. Value your impact and evaluate your role that you represent to these patients and families. Appreciate that you can make the extraordinary manageable and significant. Our graduation today represents our own before and after. We have performed an extraordinary and once again made it feel ordinary. Remember, our time, our training have changed us forever. More than ever, the world needs us to survive these times before and after, to help, to heal, and to make the extraordinary manageable. Best wishes to all of you in your future careers, training endeavors, and whatever you pursue. It has been an honor to know you and to train with you.
It's the story of our programs, graduating assembled residents. Normally, we would have had a party. Social distancing took over all our plans.
It's the story of appreciation for your patients with blocks 10 to 13. End of residency, had to pivot, and you rolled with all the changes unforeseen.
Now when thinking of your future, we are smiling because you all have trained at Lutheran. You are very well prepared and maybe someday you might be my PD.
Pretty soon now, no more case logs and no med hub. In the real world, there is no CCC. Don't forget to reapply for your license and do your CME.
These are strange times, to put it mildly, and your program specialists just want to say, from the bottom of our hearts, we are grateful. Congratulations and best wishes we convey.
From Lutheran's team at GME, you will always be part of our family. Congratulations.
Hi, it's Jim Keller again. In closing, I just wanted to re-emphasize that although we are doing this virtually, in no way does it diminish the greatness of your accomplishment to date and the pride that we have in you as graduates of Lutheran General Hospital. At this time, I would like for you to join me in reading the Oath of Hippocrates. At the time of being admitted as a member of the medical profession, I solemnly pledge myself to the service of humanity. I will give my teachers the respect and gratitude which is their due. I will practice my profession with conscience and dignity. The health of my patient will be my first consideration. I will respect the secrets which are confided in me. I will maintain by all the means in my power the honor and noble traditions of the medical profession. My colleagues will be my brothers and my sisters. I will not permit consideration of religion, nationality, race, or social standing to intervene between my duty and my patient. I will maintain the utmost respect for human life, even under threat. I will not use my medical knowledge contrary to the laws of humanity. I make these promises solemnly, freely, and upon my honor. Again, congratulations.